All right, folks, it's Monday, June 9th, 2025. It's about 3:40 a.m. Too early to be up, but I am up, showered, and just waiting for my mom to come pick me up to take me to the hospital to have my thymectomy today. I am not looking forward to this at all. It's a scary surgery, but they said it's needed for a better future outcome and control of my symptoms for my autoimmune disease. I was diagnosed last July of 2024 with generalized myasthenia gravis. My symptoms actually started around November, December of 2023. And my primary doctor initially thought that it was, I can't think of the name of it. My mind's shot. Anyway, I pushed to be tested for myasthenia gravis because I told her that my symptoms seemed to be more aligned with that than the other thing that she was thinking of. I can't believe I can't remember that. Can't remember what it was. Oh well. It's in my previous videos long ago from last year. So, but anyway, yeah, so I went about 3 or 4 months of being super, super tired. And then in, I think, March, April, I started to get the droopy eyelid and double vision. So I initially thought I was having a stroke or something, a mini stroke. And so I went to the emergency room and they checked it all out and everything seemed fine. So they told me to follow up with my primary doctor, which I did. And I did a lot of searching online. And that's when I discovered this myasthenia gravis and the symptoms that it entailed. So, but yeah, long story short, she listened to me. So she took blood work and tested for the antibodies, and sure enough, my antibodies came back high. That blood work, which would indicate myasthenia gravis, which is what I said it was. So she referred me to a neurologist, but it took a few months to get in to see the neurologist because it was like really backed up. So in July 18th of 2024 is when I got in to see neurologist, and that's when he confirmed that yes, I have not only myasthenia gravis, but I have generalized myasthenia gravis. So yeah, so I've been battling the symptoms ever since. Nothing too severe. It's been mild for the most part. Tiredness, the droopy eyelids, double vision every once in a while. My right arm is weak. So like if I try to pick up anything heavy like a case of water, I can bend over and pick it up with my arm being straight. But when I go to lift it into like a grocery cart, that's when my arm starts to shake and I can't lift it. So then at night, when I get tired, I get a little off balance with my legs. Sometimes I have a hard time sitting up out of the couch. And so I have to use my arms to sit up from the couch. And of course, my right arm gets shaky when I'm doing that because I'm trying to use the muscles in that right arm. So, anyway, that's where we're at. Hope you come along for the journey. The next video will be me in the hospital if I'm able to record. So, here we go. All right, folks, we're all ready and set to go. Oh boy, this is going to be a fun little surgery. So hopefully everything goes well. And the next section you'll be watching here will be me in recovery, or whenever I'm able to get my wits about me. All right. Hey everyone. It's 4:38 p.m. on Monday. I had the surgery this morning, thymectomy. It's all Everything surgery wise went okay. They didn't have to go through left side, thankfully. They were able to just go through The right side, I'm having a couple of issues. I can't take a full breath yet, so it's like tiny breaths. It stinks. So somebody's coming in my room, so I'm going to stop recording and I'll continue some more. Alright, that was a long break. Uh, they brought my supper. I was able to eat it. Yay. It was actually pretty good. It was a pulled pork barbecue, green beans, cinnamon apples. So it was good. Of course, they brought iced tea, but I don't drink iced tea. So I was able to eat it. Then afterwards, they they got me up, and I was able to go to the restroom with a walker. Even though I can't, I can lift my forearm and fingers up. It's tingly and numbish, but I can't. That's as high as I can move my arm. I can't move my arm up, so it's still pretty numb. But it's getting better. So the Dr. Gillespie, who did this surgery, just came in and gave me an update. She said she was really happy with it. And she didn't have to go into the left side for a better view. So that was good. She said my thymus gland was huge. She showed me a picture of it on her phone. So there's a possibility that she sent it, of course, she sent it off to pathology to make sure there's no tumors or anything on it. But if there's no tumors, there's a chance there's an other issue with it that was causing my myasthenia gravis, my generalized myasthenia gravis. So that's a good sign that with it being large, that it was the reason for my GMG. We'll, we'll find out. She said in about 5 days she'll get the results back. So yeah, other than that, the pain management is tolerable. I still got the chest tube in. So my chest, yeah, it hurts here and here when I breathe in, but when I breathe out, it feels better. I'll be happy when I can take a full breath again. I got my breathing treatments. I don't know if you can see it or not. So, if you couldn't see it, I apologize. But there's one where I have to breathe out into it and it causes a rumble. And that's supposed to help break up any phlegm or stuff in my lungs. And then the other one is just a measure of how strong my breath is. So I'm supposed to use that. I have to use the rumbly one every 10 minutes when I'm awake. So as soon as I get done with this section of the video, I'll do that. So, but my legs feel good. My strength in my legs and feet are where they should be. No issues there. My left arm is fine. It's just the right arm. And she said it could be because they had to put my right arm above my head for the whole surgery. As they went through the armpit and through the side of the ribs, so they had propped my arm up above my head for a while, and that could have caused circulation and blood flow to be cut off a little bit, and that could be the reason why I'm numb, don't have much movement in it. Hopefully that's the case, because I said my right arm is the one that's been affected by the GMG, so I've got muscle weakness in that right arm. So hopefully it's not a flare-up, and it's just because of how they had the arm positioned, which I think is the case, because It's doing better now. Earlier today, when I first got into my room, I couldn't move it at all. I could just move my fingers a little bit. But now they said I can move my fingers. I can do like bicep curls. Even though it's flimsy, it's like a Walking Dead arm. But I just can't lift it up hardly. I can get a little lift, but not much. So stay tuned for that. We'll see what that's like in the morning. So, all right. If you're watching this, the next section will be in the tomorrow morning, unless I feel like recording something later tonight. We'll see. All right. All right, folks. It's 4:30 in the morning, Tuesday morning, so the next day after surgery. And I slept with the CPAP last night. Got 5 hours in. It said I averaged over 22 episodes an hour, which isn't good. But the really bad thing is when I took off the mask, oh my God, the pain in my chest was unbearable. I couldn't believe how much pain I was in. I don't know if it was a strong positive airflow from the mask into my lungs. It was just too much to handle. But you would think I would have been in pain if I slept with that strong air pressure, but I wasn't. I woke up and I wasn't in pain. But as soon as I took that mask off, oh my God, it's like it was overwhelming, the pain from it. Yeah, I don't know. I'm going to have to let the thoracic surgeon know that when I see her today, to ask her, is that normal to have such pain after taking off a CPAP? I don't know, but oh my God. Thankfully, my nurse was in the room at the time when I took it off, and he was able to give me Oxy right away and some other medicine. Oxy was in a pill, but the other medicine was through the IV. So, and that eventually dulled the pain. Now it's just when I breathe in, it hurts, but when I breathe out, it relaxes. So, like it was yesterday, so that's fine. The pain is about a 5 when I breathe in, but then it goes away when I breathe out. So, yeah, I'm still not able to take full breaths yet. But good news is my right arm is getting better. It's still nowhere near. I still got tingling sensation in my fingers through my wrist. But look at this. I can raise it a little bit. I couldn't do this yesterday. It's still flimsy. But I can move it at least. It's not so numb from the shoulder through the elbow. It's still a little numb, but not as bad. And I can lift it now a little bit. So, yay, that means it's improving. So, 'cause I was worried that it's going to be permanent. So, but I said that my right arm is the arm that I have muscle weakness in from generalized myasthenia gravis. So, but the doctor felt like it was having issues because they had to raise it above my head to get, to get to my thymus. They went to the right side, so they had to raise the arm up above my head. And it was there for many hours, so that probably triggered it. It was probably loss of blood flow, and yeah, it was just in a bad spot. Like when you sleep and put your arm in a wrong spot when you sleep and you wake up and you can't move it at all. That's kind of what it was like, but it's just taking forever to get better. So, but progress is being made. So I just want to give an update to you. I'll give some more updates here coming later. All right, it's going on 6 o'clock p.m. on Tuesday night, so day 2 in the hospital. It was a it wasn't a great day. Dealing with a flare up of GMG symptoms, mainly
in my eyes and face where my eyelids twitch a lot. Got some twitchiness down below. It feels like it might be getting a little bit better. I still short of breath. Can't take deep breaths. So drain still in. I don't know. Warning if you don't want to see it. I don't know how much of it I'll be able to show you, but we'll take a chance here. And the cord goes down below into the container. So, drain's going to stay in overnight. Hopefully, I can get it out tomorrow. It's still draining decently, so they don't want to take it out yet. That's a precaution. They had to lower down my oxy because this whole day was just miserable being on it. I was nauseous at first, so they had to give me nauseous medicine. And then I was just been drowsy all day. I hate that feeling. I don't like being on pain medicine at all. Don't like the way it makes me feel, so I'm going to try to stop taking it as soon as possible. But my pain right now, when I breathe in, is about, it's not bad. It's about a 4 on a scale of 10. So breathe in, hurts, then I exhale and it feels better. But when I go exert myself, like I just got done going to the bathroom, where it requires more breath, more breathing, it's hard to do and it's painful. I've been on like three walks today around around out there, in my, so I'll do another one after supper after I get done eating. Here's my supper here. Span out. Okay, so it looks like some type of pot roast, potatoes, gravy, green beans, and some noodles underneath of it. It's not bad. I had a few bites of it. Top of my dinner roll. I already ate top of my dinner roll. Grapes. I love grapes. And then cottage cheese, which I can't stand. So that's not getting 8. I do not like cottage cheese. So I was hoping it was some type of pudding, but it wasn't. I was so disappointed when I looked at it. I was like, oh, pudding. Like, no. Cottage cheese. So I was like, yeah. And of course, they bring tea. Don't drink tea. In the morning, my breakfast, they brought coffee. I don't like coffee. So I'm just drinking my water. So, yeah, it'll be at least day 3 in the hospital tomorrow. We'll see. If they pull the drainage tube out, I might be able to leave by the evening. I don't know. It all depends. I'm walking now without the walker, which is good. My right hand is still tingly, but not as bad. And the numbness has... So I'm able to lift my arm all the way up now, which is awesome. So the numbness has pretty much gone away. It's just a tingling sensation in my hand and fingertips that I'm still dealing with. And of course, with my GMG flare-ups with the eyes, I'm also getting some muscle twitches in my legs. That's common for a flare-up, is the muscle twitches. Just little areas in my thighs twitch. So, all right, that's the update for now. I don't know. I might just make this my last update for this first section of video because I don't want to get it too long, and then be like a part 1, and then I'll continue to record my journey, but make that like a part 2. So I might just put together what I have and post it. So if I do that, then this is the last section. So if you made it this far, if you would hit that like button for me, and if you haven't already followed, go ahead and give me a follow and hit that notification bell so you can be notified when I post the future updates on my journey. This is the journey of a thymectomy. Hopefully by the end of the week, we'll know the results of pathology on that the thymus gland that they removed. That was big. It was bigger than what the doctor expected. So we're really hoping that is the cause of my GMG. And with it being out, then within the next year, I'll be symptom free. So we'll see. We'll see what the pathology comes. Hopefully, it's not the cancer. It's not. Hopefully, it's not thymomas that were in there. She couldn't tell because it was too big. So hopefully, it's the other thing that she talked about that's not cancer related that causes the antibodies to go haywire. So hopefully, it's that. Then I could be symptom free within a year. Or if it has thymomas in it, that's another reason why I'll still be symptom free in about a year. But then I got to deal with the cancer side of it. So we'll see. So, all right, that'll do it. Y'all have a good day. Remember to enjoy life to the fullest because you never know what life is going to throw at you. So tell your loved ones you love them, enjoy them, don't take advantage of them or your friends. Let's enjoy everybody's company. All right, I love you all. Bye bye.